Local NHS bosses have now launched a formal consultation on their plans for the future of healthcare in South West London and Surrey. Their preferred option is to remove all acute services from Epsom Hospital and St Helier Hospital. This would mean the removal of A&E, maternity, children's, intensive care, cancer care, coronary care, emergency surgery and emergency medicine from our 2 nearest hospitals. They say that they would like to provide a single new acute facility to replace those services. This facility might be located at St Helier Hospital, it might be located at Epsom Hospital, or the preferred option is next to the Royal Marsden in Belmont. If this dangerous plan is carried out, it would mean fewer beds, care delivered by fewer consultant doctors, longer journeys for most people, a single A&E and maternity in place of 2, and a facility which is only accessible via emergency ambulance or with a referral from your GP. On the 6th of January 2020, a meeting was held in Bourne Hall in Ewell, where the NHS bosses took the decision to do this. The general public are clearly not convinced by their dangerous plans, despite their attempts to paint the downgrading of 2 of our existing major acute hospitals as if it were a good thing.
Thank you. I'd just like to say that I've got very little faith, like Siobhan McDonough, I've got very little faith in the results of this consultation. I attended nearly all of the engagement meetings that you held. I was also a stakeholders reference group member. In fact, I probably attended the stakeholders reference group more often than any other member. When I was at the engagement meetings, the overall feedback from the public, as far as I could discern, was that they really did not want to lose their local acute hospital. And the stakeholders reference group, that's much quoted in your reports, I attended every single meeting except the crucial last few where the criteria were established and the decisions made as to which should be the chosen hospital, site for the new hospital. I was prevented from attending that because to attend it I was asked to sign a non-disclosure agreement, which I understand is totally illegal, and I refused to sign that agreement, and therefore I wasn't told where and when those meetings were going to take place, and I couldn't take part in them. This whole closure process is being painted as something that's good for everybody. In fact, you know on the board, as well as I know, that it's part of the Sustainability and Transformation Plan, which decreed cuts, £22 billion worth of cuts to NHS spending nationally. And in our area, you were asked to save £1 billion, and that's why you're proposing to shut. And it says in the original plan that you published that you intended to close 1 or 2 of our major acute hospitals, and that's exactly what you're doing. It's got nothing to do with improving anything for anybody. The Competitions and Mergers Authority have said that merging hospitals increases deaths by 550%. Shortly after they put out that report, the government disowned them and said they didn't want to use them anymore. But lots of other people, the BMA have said, we need more beds, not fewer. We've got fewer beds in this country than any developed country in the world. We have lost thousands of beds in the last 9 years. You are proposing to cut up to 200 beds in our local area. You should be so ashamed of yourselves. You should be running from this room in shame. Some of you are doctors and you've taken oaths to first do no harm with your actions, and your actions are going to kill us. People in this room will die because of what you're proposing. We have just had the worst A&E attendance time records in the history of the NHS. And you are proposing to take more acute beds away from us. We are not hitting the bed occupancy rates. There are too many people in too many beds, and that is causing cross-infections in hospitals. And you're proposing to take our hospitals away from us. You should be building on the facilities we have. We are the predicted population growth in this area, and this is the official official population growth, not population figures that you might come up with, is something like 25% increase in population in this area in the next 20 years. And you're planning to take away from us up to 200 beds, when already in this area we have fewer beds per 1,000 people than they have in the rest of England, which is at the very bottom of the international list of hospital provision. And you've been saying for 10 years now that you don't have enough consultants. First, stop threatening to close our hospitals, and some consultants might want to come and work for you. And second, you've had plenty of time to promote and train consultants to do the job that we need them to do.
All right, so breaking that down, I hope I'm not going to miss out too much. Beds, cost cutting and population growth. Who could take that on, please?
Well, I tried to explain to the committee earlier about the bed stock, so we are looking at a small increase in the number of beds through these proposals. It does, absolutely would acknowledge that it does depend on where the major acute services are cited, and that's outlined in the consultation document. And obviously, in terms of the investment, then we do have £500 million available to us to invest in new facilities and improve existing ones. And I think that's a really important point in terms of improving the present facilities on all the sites, regardless of what may be our final preferred option. And just to remind everyone really that we are going into a consultation. No decision has been made about options, and we obviously will embrace. We will look forward to receiving the information outlined in the questions through the consultation process.
Where's the none of the above option?
As a local GP, I'm a GP in Surrey Downs. I'm really confident that this work is going to improve the health of our local population. It's worth noting that we're not talking about closing hospitals, we're talking about centralising services, but keeping the current hospitals open. And as we've mentioned already, and as you'll see through the pre-consultation business case, we're going to be running 85% of the services that currently sit in each of the hospitals going forward. And what we've done is described by my colleague Dr. Murray, by centralising services to one major acute site, one specialist emergency care hospital, we know that that will improve outcomes for our patients and local residents. We're also doing lots of work locally with our public, with our local council, with our district and boroughs to look at how we can prevent people from coming unwell. And that's another key piece of work that will help the population moving forward. So as a local GP, I'm not here to rubber stamp anything. I'm confident this is going to improve outcomes for our residents.
The people behind this dangerous plan are putting consultation leaflets through your doors. It explains their three options, all of which would see acute services removed from one or both of our local major acute hospitals. The document does not contain an option to say that you disagree with all of their proposals. If you receive one and you decide to fill it out, then we suggest that you tell them, in no uncertain terms, none of the above. Tell them that we need to keep all services at all of our existing hospitals. We need more beds, not fewer. We need more doctors, not fewer. We need more hospitals, not fewer. We need more capacity, not less. And you might like to sign our petition at koshh.org/petition. This might be our last chance to save our local hospitals.